Cataract surgery is the surgery by which a cloudy lens is removed and replaced with a clear kind of plastic lens. It's an acrylic lens. It is the most common surgery performed in the UK and worldwide, and also one of the safest. It is not complication-free, but the complication rates are very low. And with this respect, we can call it a highly successful type of surgery. When a cloudy lens builds up, we call this cataract, the light entering the eye is blocked. This produces a blur vision, especially for distance. But also, the little changes in the lens, like opacities in the lens, they scatter light. And another symptom is that of glare with bright lights, typically at night when driving against oncoming traffic. So removing this cloudy lens that causes glare removes those symptoms and restores sight in as long as the rest of the eye, from the ocular surface to the retina at the back, is healthy. The risks are during the surgery and after surgery. Even a straightforward cataract occasionally might not go according to plan, and the little tissue that supports the new lens might break up and the vitreous gel comes out. This is not the end of the world. The surgery takes a little bit longer to do a bit of cleanup. Very occasionally, which is less than 1 in 500, a second operation might be required to fix things that didn't go well on the day. And if there is a complication, most of the times, although through a more prolonged postoperative period, things go well and can be rectified. There is something else that the patients need to be aware. Even when the cataract surgery is absolutely spotless, could not have been done any better, there are hearing problems that are seen in 1 in 100 patients. And these are unpredictable, and it's the individual patient response to treatment. There might be inflammation, but one that bothers patients a lot is that after improving their vision a few weeks later, the vision goes blurred, particularly for near, and is waterlogging at the macula, the central part of the retina where the sharpness of the vision is. This again can be treated medically most of the time, and very rarely is a long-standing problem. About 1 in 10 patients at some point in their life, so within a few months or many years later, might experience symptoms similar to the original cataract symptoms. And this is because the very thin tissue behind the new lens may start becoming opaque, so it becomes a little bit thicker. If that happens, an assessment can quickly identify the problem, and the solution is a quick outpatient procedure, very safe, with a laser beam called the YAG capsulotomy. Nothing to worry about. This happens in about 1 in 10 patients. This is an excellent question. One thing that is important to assess is the ocular surface. If the ocular surface is healthy, then the recovery after cataract surgery is quicker. So detecting dry eyes is very important. Not all patients with dry eyes are symptomatic. If the assessment before cataract surgery is not careful, this is not identified. And any surgery to the eye can make the dry eyes worse. One of the reasons for disappointment after cataract surgery is that the patient feels discomfort and blurred vision for many months, 3 to 6 months. And this is all about managing expectations, identifying an underlying dry eye, prepare the patients with good lid hygiene in the period intervening to the surgery, and lubricating drops as necessary, and advising that if there is protracted discomfort after the cataract surgery, this can be rectified with lubricating drops and daily lid hygiene. And it's not a blinding situation. It's just an inconvenience that can be resolved. The vision tends to be better from day one. However, it might take a few days for the vision to gradually improve. Generally, unless there have been some particular problems, within a week, the vision is very close to the maximum vision that one can achieve after cataract surgery, apart from the need to correct the focusing. Because what we do with the cataract surgery, we replace a cloudy lens with a clear one. But there is still a need for, generally, for a small spectacle correction, for having the very sharpest vision for distance, but also for reading. There are not really very many long-term risks. There are more short-term risks in the healing periods. It's sort of like an equivalent of another cataract, or their symptoms might happen because the tissue behind the lens becomes cloudy, but that is called a thick posterior capsule, and that is easily resolved with this YAG laser procedure as an outpatient polishing of that tissue. Patients who are very, very, very short-sighted, so it's called high myopia, with any surgery to the eye, they have an increased risk of retinal detachment. But if they are unlucky to have one, this will be in the first 6 to 12 months. Longer term, it doesn't make really much difference. And I also would like to reassure patients with wet macular degeneration or macular degeneration that cataract surgery doesn't really increase the risk of getting worse.